7 medications that cause dementia. Do you ever find yourself forgetting little things, like why you walked into a room or a friend's name, even though you used to remember them easily? If you're over 50, these moments can be worrying, especially when you hear the word dementia. Today, I want to talk with you about something important. Some common medicines, even ones you get without a prescription, might be affecting your memory. In this video, we'll discuss 7 types of medications that have been linked to a higher risk of dementia and share some simple ideas to help protect your brain. As we get older, many things change in our body. One big change is in our brain. Our brain has a natural shield that keeps harmful things out, but with age, this shield can start to let in unwanted substances. At the same time, a very important chemical in our brain called acetylcholine, which helps our brain cells talk to each other, decreases over time. Some medicines block acetylcholine even more, and that can lead to memory problems later on. One of the medicines many of us use is diphenhydramine, which is often found in allergy medicines like Benadryl. While it can be very helpful for allergies and even for getting a little sleep, over time it may block acetylcholine too much. This means that using Benadryl for many years might make it harder for your brain to work as well as it used to. Another group of medicines to be aware of is called benzodiazepines. These include drugs like diazepam, known as Valium, and alprazolam, often called Xanax. They are usually used for anxiety or to help with sleep. As we age, our body holds on to these drugs longer because our fat tissue keeps them. Studies have found that using these medications for a long time can increase the risk of developing dementia. Many people also take medicines for heartburn, like omeprazole, which belongs to a group called proton pump inhibitors, or PPIs. These drugs help reduce stomach acid, but when used for a long time, they may change how the gut and brain work together. The research is not completely clear yet, but it is enough to make us think twice about using them for many months in a row. There are a few more kinds of drugs that have been noticed in studies. Some older antidepressants, like amitriptyline, block acetylcholine strongly. Using these for a long period might not be the best choice for our brain health. Then, there are opioid painkillers such as morphine or oxycodone. When taken daily for a long time, they can also increase the risk for memory issues. Some medicines used for behavior changes or agitation, like certain antipsychotics, for example haloperidol and risperidone, have also been linked to a higher chance of developing memory problems. Lastly, medicines for bladder control, such as oxybutynin and tolterodine, which help with incontinence, work in a similar way by blocking acetylcholine. You might be thinking that if you need these medicines, you must keep taking them, and stopping suddenly isn't a good idea. That is true. Many of us take these drugs because they really help with our daily issues. But here is the important part. It is a good idea to review your medications with your doctor to see if you really need them, or if there might be a safer choice. Sometimes, newer medicines or non-medicine methods might work just as well without the extra risk to your brain. One simple step you can take is to have a brown bag review. This means you gather all the medicines you take, whether they are prescribed, over-the-counter, or supplements, and bring them with you to your next doctor's visit. Ask your doctor or pharmacist if each medicine is still necessary and if there is a safer alternative that is better suited for someone your age. For example, there are newer allergy medicines that do not block acetylcholine as much as Benadryl, or non-drug methods that can help you sleep better at night. If your doctor suggests that you stop taking a medicine, it is very important not to quit suddenly. Instead, you should slowly reduce the dose over time, a process called tapering. This helps your body adjust without causing withdrawal symptoms or a return of the problem you were treating. Your doctor can help you come up with a plan that feels safe and manageable. Aside from checking your medicines, you can also do simple things to support your brain. Regular exercise, such as a daily walk, helps keep your blood flowing to your brain. Eating a healthy diet filled with fruits, vegetables, whole grains, and lean proteins, like the Mediterranean diet, can also improve brain health. Staying socially active and engaging with friends and family keeps your mind stimulated, which is very important for preventing memory loss. In short, as we age, our bodies handle medicines differently, and some drugs may start to have side effects on our brain. The 7 types of medications that have been linked to a higher risk of dementia include common allergy medicines like Benadryl, benzodiazepines like Valium and Xanax, heartburn medicines such as omeprazole, older antidepressants like amitriptyline, opioid painkillers, certain antipsychotics, and bladder control drugs like oxybutynin. Taking time to review your medications with your doctor, slowly reducing or switching medicines when needed, and adding healthy habits to your daily routine can make a big difference in protecting your memory. Your brain is one of the most important parts of you, and it deserves care and attention. By taking small steps today, you can help keep your mind sharp and protect it for the future. If you want to learn more and get practical tips on how to make your medicines work better for your brain, I have a free guide called Is My Medicine Brain Friendly that you can download. This guide has easy-to-follow advice and questions you can ask your doctor to help find safer alternatives. Thank you for watching and for taking the time to care for your health. If this video has helped you, please subscribe and click the bell icon so you never miss a tip on staying healthy and sharp after 50.